Okay. Good morning, everybody. Thank you so much for joining us today. In case you're not sure who I am, my name is Elise Fry, and I'm the director here at URL Insurance Group of our Health Plan Options Department. My team oversees group and under 65, so please feel free to reach out to myself or anyone on my team for any assistance. Now that we have that out of the way, I'm excited to have Nick and Brad here from Geisinger to go over Geisinger's GFA product. I hope that you find this valuable. It's something that we are actively pushing with their new Cigna network, and the GFA is just a really good product. So I hope you enjoy this. But without further ado, I'm going to let Nick properly introduce himself.
Thank you, Elise. Good morning, everyone. As mentioned, my name is Nick Gammo. I'm the Commercial Small Group Manager at Geisinger. This was just supposed to be about GFA and how you can use it as another product to sell to your groups across our service area in Pennsylvania. But with the recent news of the Cigna network being part of Geisinger, or Geisinger using the Cigna network on our PPO plans effective June 1st, I decided, well, we're going to kind of start off the presentation by going a little bit through our service area and then what you're going to get out of the enhancements by us utilizing Cigna as our wrap network. So this is our service area as it is today. All of the counties that you see shaded in blue, that is where a business must be located in order to offer a Geisinger Health Plan. Those other counties that are shaded in like a green color, those are hospitals that are not technically in our service area, but those are counties that are not in our service area, but they have the providers and the hospitals as they would in the other counties. So your Philadelphia hospitals, for instance, they're all part of Geisinger's footprint as far as our network is concerned. And speaking on our networks, we have 3 offerings. This is on our ACA plans, our level funded GFA plans, our fully insured plans, as well as our ASO. Again, for today's purposes, we're going to be talking about everything in the scope of GFA. So our broadest network, and that's going to be, again, in that entire footprint, is our all access network. That's most of what has been selling in the market as long as we've had these networks. That gives you the benefits of, yes, Geisinger, you have Geisinger, so you can go to Geisinger, but you can also go to those other larger name facilities such as Lehigh Valley, Hershey, St. Luke's, Johns Hopkins, the Philadelphia hospitals like CHOP, Wills Eye, Penn. Those are all in that network. And at the other end of the scale, if you look over to your right, is our Premier network. So that's available in certain counties, and that is more of a skinnier network to utilize, give you the most bang for your buck in terms of cost savings. That is going to primarily be Geisinger providers and hospitals, as well as St. Luke's, Hershey, and Johns Hopkins. And then in the middle, we have kind of a hybrid, a tier network structure, where your tier 1, you are going to benefit by having lower deductible, lower copay, but that is going to utilize all those premier doctors and hospitals in tier 1. Tier 2 is going to be the all access network. And again, because you're technically have more cost sharing for tier 1, but then you have less cost sharing in tier 2, that is priced somewhere in the middle between the all access and the premier in terms of premium. And this is just a copy of our all access hospital flyer. You might have to zoom in, but in that entire service area, and I'll go back to that so you can see it. In that entire service area that you see shaded in green or in blue, really there's no facility that we don't work with and doesn't accept Geisinger. The exception that comes to my mind off the top of my head is probably UPMC Bedford. and in Bedford County, and they do not accept, we do not work with them. So that would be an out of network benefit the way things are right now. And as I mentioned, for June 1st, we are utilizing the Cigna PPO network for our WRAP network. This is replacing First Health Network in terms of the out of area, those employees that live outside of Pennsylvania that might currently utilize that First Health Network for their out of network benefits. It'll replace that, but it will also serve as a WRAP network for all employees, and that's regardless if they are located in Danville and right next to a Geisinger hospital, or if they're right on the fringe, they can still utilize this Cigna network. Now, Cigna is probably one of the best names that we could think of, most recognized to be utilized to basically give us a national network. And that network is going to consist of over 1.5 million providers and 6,500 hospitals. And another thing going for them is the process of how they handle the claims and everything that maybe some of you are familiar about how that worked with First Health as our WRAP network. Cigna just has this customer experience that is pretty much top notch and easy to use. So I'm going to go again now how this is actually going to work. So that's our Geisinger service area. There's used to be 42 counties. I believe it's up to 44 counties that the group could be located in to have a Geisinger plan. And on this graphic, you'll see the red shaded area, again, still falls under the Geisinger network. And even though it is national, we're just looking at Pennsylvania for right now. So that gray shaded area, those are hospitals that would just be out of network with Geisinger. They're kind of at the edge of our territory out west, UPMC in Pittsburgh, let's say. They do not participate with Geisinger. They are not in our service area. So therefore, anything that needed to happen through them will happen through Cigna. And the Cigna logo is going to be on our cards. So those are, now you can go to those for your in-network benefits. And on that Premier and on that Choices network, Cigna, any out of the area hospitals are going to, or providers that are outside of Geisinger's area are automatically going to fall into that tier 1 on Choices or on the Premier network. And so how it will work, so basically the way it is right now is if a doctor or if a member has a PPO plan, the simplest way to put it is if you're in Geisinger service area, you're going to utilize Geisinger when you're in the service area, and you'll utilize Cigna when you're outside of the area. There's nothing special the member will have to do. Their card has all the details on it. So those on the PPO, again, it'll be billed at in-network benefits. Basically, just again, think about it as an expanded national network. So now on the HMO side of things, currently, if there's a dependent that's outside of the area, they will have access to Cigna on the HMO plan. If it's an out of area employee or somebody, if there's an out of area employee, they will have to opt for a PPO plan. That's just part of our normal out of area requirements. But in network, those that have an HMO plan will be limited to Geisinger as their primary network.
Hey, Nick.
Yes.
There's a question in the chat that I just figured we could quickly answer, but is there an enrollment requirement to have access to Cigna?
Okay, that's a great question. So again, and this is why I wanted to get at it from a new business standpoint. Our out of area requirements, where we can have no more than 40% of the employees out of the area, that is still a thing. But as far as Cigna is concerned, every group that has Geisinger will have access to that Cigna network.
Great, thank you.
And that could be a group of 5 if they're in a PPO plan and they want to go to, they have that owner that has a a procedure done every 6 months or a test done every 6 months at Sloan Kettering, and they live in Union County or Montour County, right in the smack dab Geisinger service area. In the past, that's been something that, oh, your rates look great, your benefits are great, but the owners, they really have to go get this scan done every 6 months in New York. They have that now, and that could be a group of 5, that could be a group of 3. So there's no requirements to have that. But again, want to stress that our out of area requirements are status quo right now. With we need at least 5 employees enrolling, and no more than 40% can reside out of area. And then just a real quick walkthrough of how, if you want to check the Cigna network, you don't want to just take my word for it that I would bet that all those people's concerns, all those members' concerns of a doctor that's outside of the area are in Cigna's network. In order to do that, you're just going to go to Cigna.com, find a doctor, and then enter the details. And the most important thing is that step number 5. You want to select the PPO, the PPO network at the bottom of the screen. So that's all we have for Cigna. Are there any more questions about that?
I don't see any posted at the moment, but who knows? We'll see.
So now into the meat and potatoes of the presentation. So our Geisinger Funding Alternative is our level funded plan that we offer for groups that have at least 5 enrolled. And kind of a high level benefit of what it is it follows our fully insured bid market large group plans. What that means to your ACA clients is we don't have we're getting away from the whole platinum level benefits and silver level benefits, which have crept up, where now silver is a $2,000 deductible. Gold is a $2,000 deductible, which then means you have to have a certain requirement for what your copays are for your doctors. With our GFA plan designs, they range from a $0 deductible all the way up to a $5,000. There are qualified plans, there are PPO plans, there are HMO plans, but all of those, regardless of how high you go in deductible, you're still going to have basically the same PCP, specialist copay, emergency room copay, and really is an improvement and an enhancement, I should say, over the benefits that those ACA clients will have. We offer 4 drug prescription plans with that, and usually when we obtain a request for a quote for our Geisinger Funding Alternative GFA, we usually map the benefit closest to what they have. One of the things you'll notice, though, when you start, if you haven't already, been getting proposals for these for your groups that have Capital or have Highmark or have Aetna, a lot of the times, actually, probably, I'm going to go out on a limb and say like 9 out of 10 times, our benefits in one shape or another end up being a little more richer than the competitors, even on their own level funded plans. The one thing else that we are offering on our GFA plans, before I go into what they are exactly, is we are able to offer an implementation credit for groups that have at least 10 enrolled and are coming over to GFA. And because we all know that there's a little bit of pain and change, as well as everything might be running. When you're getting new ID cards from a new provider, it seems like Murphy's Law always applies, and maybe sometimes they get lucky and it doesn't. But in any event, if we need to get into a position where we are making a group whole by covering most, if not all, of their surplus that they would be losing from moving from another level funded carrier, or we just need to get that extra couple points to get where we need to be, we do that through an implementation credit. And we started doing this about 1.5 years ago. Sometimes the group need it, sometimes they don't. Really, it's your job as the broker to let us know, what we need to do to win your business in this case. The implementation credit is not oh, we're going to give you a lower price and then we're going to try to rake it back the next year on a renewal. This implementation credit is going to be one time paid 60 days after the installment of the group's effective date. And if the group performs well in GFA, their renewal is going to reflect that. If they don't perform, their renewal is going to reflect that. And that's another beautiful piece of moving a fully insured small group over to a level funded product. So, for those who aren't aware, what is GFA? And it's our level funded product. It's available to groups with 5 to 199 enrolled. For those groups that are under 5, if they are with Geisinger for a year on a fully insured ACA plan, as long as they have 2 enrolled, they will be offered a GFA renewal when their renewal comes out. We do have a couple groups where they performed really well, and we know because we've seen them for a year in ACA, and they actually, instead of going with the norm of an increase every year, as that risk pool kind of doesn't perform that great, those are groups where now they're seeing a decrease. Again, all groups are able to choose a standard benefit plan. I kind of mentioned we have a range of deductibles. And these are plans that are made up of fixed costs and then the aggregate claims, or what we expect that group to utilize in claims. So that's done through an underwriting process. Again, for purposes of small group, there's a $30,000 specific deductible on that group. So one person has a claim, but the other 10 employees are performing well. After $30,000, that person has met their specific deductible, so they can't really take anything else off of the entire group's aggregate claims. And we do write to 110% risk corridor. So as it is, we expect that group to perform at X, and then we add in 10% for a little bit protection. But again, if we're right about the group and the group is at or better than that, the other great thing about GFA is they can expect a surplus return. And we do that through an experience credit where they would have to renew. So looking at it from a optimistic standpoint, which does happen, a group performs really well. We say their aggregate deductible for the year is going to be $100,000. At the end of the year, when the settlement occurs, they only utilized $50,000. So now they have a $50,000 surplus. We offer either 100 or a 50% back option, but most groups are on that 50% option, as it tends to be cheaper in premium day one. So 25% or 25,000 of that surplus is going to be going back to the group. And then lastly, one of the fixed costs is our terminal liability reserve, which pays claims run out should that group not renew with a GFA plan the next year. Any claims that come in that came in from that 12-month period they were with us, if they come 5 months down the road, a month after they leave, that terminal liability is paying that claim. So the group, when they decide, hey, this isn't for us, we tried it for a year, and they walk away, they have no further liability. Again, I assume that mostly everybody has worked with either Aetna AFA or Capital's ASO and stop loss product. But for those of you who are newer to the level funded arena, I would say probably more than half of our clients in the small group are actually on that type of product. And what it utilizes, the selling points to say to these groups are, if you're in ACA now, you can always, if it doesn't work out for you 1 year, treat it as a 1-year savings. And then you can go back to whatever carrier has the lowest cost ACA benefits or plan that works for you. You go back to a 5-tier rating structure where every employee will have the same rate. Every family will have the same rate. Also, when it comes to utilization, that group is getting reporting on what they're using. So, and Dustin, I just noticed your comment. I'll get to this in a second for you. That utilization report, they'll get a report every month saying, here's what you paid in, here's what we paid in claims for you out of that fund. And then you'll get a rolling forecast. Now, you don't see who's using it or anything like that, but you do kind of get that snapshot of how well that group is performing. And at the end of the day, the phrase that I like to use the most is with GFA, the group is really in charge of their own destiny. If they take advantage of our wellness programs, if they have their on-site visits to help manage chronic conditions, if they even utilize Geisinger doctors, which, because we are part of an integrated health system, the Geisinger doctors work with the Geisinger insurance to get all sorts of case management for people with chronic conditions. To actually, it's proven that the Geisinger insurance and the Geisinger facility, Geisinger doctors have created healthier outcomes. But without kind of getting into all that spiel about wellness, these groups in GFA, they have tools where if they, their health is really going to determine what their rates are moving forward. And, to tell a group, hey, I know you're used to a 5% increase every single year, 10%, sometimes 12% increase, depending on how a specific carrier filed. And they're not alone. It's every group that has an employee that's of that age, because it is age banded, they're all getting that increase every year. You can go to a group and say, this is a plan that your guys don't even use the insurance. This is a plan where it's going to benefit you. And at the end of the day, there's money to be back. And Dustin, to answer your question, I couldn't give you an idea. So his question is, with the option of getting 100% back of the surplus or 50% back, what is included in that? So yes, I think I know that if the group wanted the 100% back, it is a little bit of a higher cost. And on the small group side, it's been so long since I've actually had a request like that come through. I couldn't tell you about how much higher of a premium that is. It is a higher premium, but I would just be making up a number right now if I told you about exactly or roughly how much of a higher premium that would be.
Hey, Nick, just to just to piggyback off of that question, just in case people are curious, is it possible when we send in the quote to request both options so that we could maybe just see it or not? I don't know the rule on that on Geisinger's end.
That's a good question too. And as it is right now, I would say, why not?
Yeah, I mean, I've never been asked for 100% either, so I'm with you. But to actually, know the difference, maybe on the next one I send, I'll have the girls request both, so we have a better idea on that.
And when we're quoting new business, and that might be with level funded now, I haven't even seen a renewal that says they're in that class of getting 100% back. Everybody's getting 50% back.
Oh yeah, I've not run across it myself either, but maybe that we'll know how much the difference is then, I guess.
Sure. But yes, definitely request it until we're told, hey, until an underwriter says, hey, this is too much work for us, you need to have them make it up.
Exactly.
For that case, why not? Let's do a couple of them.
Nope, I'm making a note of it. Thank you.
This is just an example of one of our plan benefits. So this one is $1,000 deductible. Office copay is $20 and $45. The emergency room copay is $150. We're usually often the lowest cost for that benefit for a member compared to the other carriers. But yeah, it's pretty much straightforward benefit designs like you would imagine, or if you do anything in our fully insured mid-market or large group, those are the plans they follow. Again, for the smaller size groups up to 99 enrolled, There is that 30,000 specific deductible. That contract is a 12-12. If they leave again, the TLR kicks in for 48 months. The aggregate, that's pretty much all standard with all of our plans right now. What you see on the left. Again, we can request 100% return, but for what we've seen, 50% is the norm. So again, anything that falls under the attachment point, meaning like the max of what the group funded out throughout the year, 50% of that does get returned within 60 days of them leaving GFA, but not leaving Geisinger, or if they stay with GFA. So group goes with GFA, whatever reason, our ACA rates will look more attractive to that group into the following year. If they have a surplus and they slide back into ACA, they would still get that surplus. But if they leave Geisinger, they do forfeit that surplus. So again, that contract has to be enforced for a whole year. And really, that's pretty much everything there is to say about this slide from my perspective. So now the part that excites me is, all right, what do we need to quote this product that promises tiered rates, money back potentially, implementation credits, and the ability for a group to actually see a decrease on their premium if they perform well. So again, it is available in the small group segment. The group has to have at least 5. As long as they are in one of those counties listed below, the only thing we would need is a census and a copy of their renewal. And as what do you need for a census? Do we need a specific census? Do we need a specific template? We don't, but basically that census should include in whatever way it's demonstrated the person's name, date of birth, zip code, gender preferably, and copy of the renewal.
You can also, just to piggyback off you again, sorry, Nick, you can reach out to Courtney or Jackie, whoever your assigned rep is here at URL, and one of those ladies will send you the paperwork needed to quote. And it's also the checklist, the Geisinger checklist for quoting is also in the handouts. But again, just reach out to one of the ladies and they'll get you the information.
Yep. And so yeah, we're really excited. We started utilizing it says RX quoting. It's actually using RX and medical claims data, de-identified, of course, that assigns a score to a group, and we incorporate that in our underwriting models. So essentially, if this tool gets a hit on these employees and it comes back with saying, you know, hey, this group is a good risk. This group has a claim somewhere that's millions of dollars expected next year. You know, obviously they're going to get a bad score. But should these groups come back, they'll get a score. Underwriting puts that in and into their model, and that's where we usually just take the renewal into effect to say, okay, this is the plan they have, and strategize to come up with a price that could be most effective. And it's unfortunately, like anything else that's underwritten, I don't have a crystal ball. I can't tell you that every single quote you're going to put through is going to come back, wow, this is so much better. Sometimes a group that's an ACA and has a good populate, maybe 40 people in their plan, if they're not already in a product like this, there's chances are that there's a reason why they're an ACA, but it never hurts to look. When you go out through Benefix and you put that Benefix census in and you check off, yeah, we're going to show Geisinger. There's counties where Geisinger is the farthest thing from competitive in ACA. And for the time being, while GFA is not on Benefix, you can take that same Benefix census and submit it through whoever you work with at URL and request a GFA quote with just, again, the renewal and that same Benefix census. I'll tell you right now, piggybacking off of that, the South Central counties, Harrisburg, Lancaster, York, Huntington County, Cumberland County, our ACA rates just aren't competitive. We've seen the same data that and it's great that you want to keep including Geisinger when you're shopping for renewals for your clients. But really GFA is going to be your best shot at putting Geisinger in a great position. And whether the group currently has an ACA plan now, is enrolled in a grandmother plan with Highmark up in the northeastern part of the state, or is currently level funded and with the capital type plan, really we are winning some business, and you're definitely disadvantaging your client to not take a little extra step and get actual underwritten rates for those groups in the future. So you'll notice that list is not all of the counties in our 44 county service area. We are working on expanding that. I know Center's not in there. Susquehanna County is not in there, as well as some other ones, but that's something we're working on, expanding this methodology to quoting to in the near future. In those counties that are not listed there are more requirements, but get in touch with Elise's team. And like she said, there's a checklist that you can use. And this is just a copy of our broker commission, what we pay. So again, going back to fully insured ACA, it is 50-year 1, 32-year 2, and then 30-year 3. Our GFA is going to always default to 30 when you request a quote for GFA. If you need to get 36 or you need to get 42, or I've seen as high as 75, you can also go down below 30 if you wanted to too. But for those who like money and you want more than 30 and you provide a great service that's worth it to the clients, we don't want you to take a haircut by showing this. And we have still won groups where we're competitive in price and that commission was more than 30. So don't be afraid to ask, because we want to take care of everything that, we want to keep you whole at the end of the day. Is Geisinger, a question that came in, is Geisinger in other states? So again, we are the 44 county service area that was at the beginning of the presentation. The group has to be located in those counties. If you have a group that maybe is located somewhere in, let's say, York County, but has 15 employees in Maryland or 15 employees in California, as long as those employees are less than 40% of the populations, or the population of that group can have them. We can have employees in all different states, but the headquarters need to be located, or a physical location, I should say, that the group is written under would have to be in Pennsylvania. A couple other questions.
Like you have some more questions in there.
I have a health insurance license. Can I provide insurance for group employees at another employer's? Mr. Thoda, I would say if you can try to rephrase that a little bit for me, I could definitely try to answer that for you.
Yeah, I'm not quite sure on that one. But just in general, you couldn't write a plan for, A company and then include employees from C company. You'd have to write them separately unless they were commonly owned, but then everybody on both has to be offered. I'm not sure if that's what he's asking, but it has to be a true employer-employee relationship where they are on payroll, W-2 employees with that company that you're writing it under. But I'll let you go with Teresa.
Well, yeah, another thought, if this helps you at all with that, if you have somebody who owns a KFC and a Taco Bell and a Burger King, and they, those are all 3 different locations, they might be in 3 different counties, all in Pennsylvania, and they can offer one plan and incorporate those different businesses because they have that common ownership. Mm-hmm. As long as they're offering, not just a specific, employees at those businesses. They're everybody then, and that falls under, wherever we need to be in terms of the group size certification and their FTEs to make sure we're quoting the appropriate product, which GFA is not going to be an issue. That shouldn't be a problem.
Well, GFA is the appropriate product, Nick, right? That's
Yeah.
the appropriate product.
Yeah, that's good. Yeah, the greater pool of people you get it, even if it leaves my department and it goes to the other manager that handles large group, that's fine. Yeah.
Still with Geisinger.
Teresa, GFA would not be an option for a new business since there's no utility. So that's another great question. So with GFA, and this is kind of like the fine print that I didn't go over that I actually will go over now. So a group needs to be in business for 2 years or more. Even now, if that group doesn't have any coverage right now, but they've been in business and now they're just starting to offer insurance, that doesn't necessarily mean they don't have any claims. They might not have claims as a group, but those people, I imagine if somebody needed services, were going to the doctor. So in that case, as long as that group's been in business for 2 years, we can definitely write it. Some other fine print stuff. So we have a slide that I purposely removed from this presentation where it's like, who's a good fit? Because I really don't like the way that things are worded in that. But one of the important things, especially if you have a fully insured group now, and GFA so far, I haven't lost you, and I've got a little bit of excitement to try to go quoting this product. Is that group should be a group that isn't constantly getting harassed by people for claims, and somebody that pays their bills on time. And while we missed this month's payment, but they square up. That's a totally different story. We do put the group through a credit check process, and they do have to get a minimum score in that to be eligible for it. Because after all, the monthly premium does not change at all. That's another thing I want to highlight. While the monthly premium doesn't change based on the claims, part of every payment from the premium they submit every month on the 1st goes towards paying the future claims they might have. And if they're not making that premium payment or they're delayed in that premium payment, the claims can't get paid. So there really is minimal to no grace period with paying the claims or with paying the premium. So, groups should be in kind of financial good standing. And, that's one of those things where they also have to elect ACH payments. They can't send in a check. They can't pay by a credit card. They would just have to either fund a separate account every month if they want, like they like paying monthly and like having control. They can fund another checking account and use that to pay Geisinger through an auto debit process, or just like regular ACH through their normal business account.
And then also, in case you were asking about like if they can quote it at all or anything, if it's a new business outside of the 2 years, if they have no current coverage, like Nick was saying, the worst case scenario is that we might need some medical questionnaires if they're a virgin group, no health history, a certain size in certain counties. So that's part of the checklist, Teresa. If you go to the handouts, you'll see it when you need them, when you don't. But in case that was part of your question, I just wanted to throw it in there. And now I'll stop my 2 cents.
Well, that's any help I can get. So now the other thing that we do is we currently offer a broker bonus for new business, where regardless of product type, it is current state. This may change. We might start doing something new in the fall, but as of right now, we do pay flat $100 per subscriber in the 1 to 50 segment. And I'll just let that sit there for a second. And where are we next? So just because I got to throw a little bit of a plug for a large group in here. It's very much still a thing at Geisinger. If you have over 50 full-time equivalents in your insurance plan. Same type of product networks, included benefits. You do have refractions and impacted wisdom teeth, and all the same benefits you would with other plans. Our HMO plans, now that I see it in here, regardless GFA, ACA, large group, small group, HMO, there are no referrals. And that might be something else that you want to look into, um, in the event that a group wants to get down as cheap as possible. I'm frozen. Oh, there we go. Okay. So I think I actually sent the wrong half of the presentation in, but this is oh, yeah. I'm just going to kind of go through this a little bit. Somehow, two of the presentations got merged at the end here. I'm going to see if there's anything else we can use here. No, that's that. I guess that was pretty much it there.
Well, that's good then. I mean, I feel like people asked a lot of decent questions, and hopefully, this just creates a platform for them to move forward. And again, when you aren't sure or want to reach out about any quotes or anything, just ask Courtney or Jackie or myself. We'll get you what you need, walk you through it if you're confused on anything. But yeah, no, like I really appreciate this, Nick. I feel like it went really well. I got a lot more questions than I'm used to, so I like it. But yeah, thank you again for doing this.
Yeah. And if, just again, I guess I could wrap it up. So all the issues, in the past, any issues that a group will have, comes down to price, network, access, and benefits. And I think we've always been a leader in benefits, regardless of what our plans have been. ACA was kind of turbulent with what it did to the small group market and took away that medical underwriting piece. And, our network at one time was, oh, I have Geisinger, I have to go to Geisinger. Well, that's been debunked, but we are now expanding on that again for June 1st. It's going to be a national network. Now, again, Geisinger might not be paying the claims, but that person that has the plan, they have the same ID card to go get services at Geisinger. Now they can go anywhere else that Cigna PPO is accepted. Again, we can offer coverage out of Pennsylvania to employees that reside outside of Pennsylvania. And with GFA, again, the premium of the cost every month, unlike a traditional traditional self-insured plan, your payment every month takes care, your employer contribution and your employee contribution make the premium whole. That doesn't change month to month. So you've got your tiered rates, you have better than ACA benefits. And the one thing I will say over other carriers that offer level funded products, this is a bonus for those that stuck around this late, is that we currently, right now, I could make this statement, we do not bucket our renewals. So that group on ACA that GFA group that is getting a $20,000 surplus when we only expected them to get maybe a 5, but they're getting a 20 because they're performing real well. You can anticipate they're not going to get a renewal that's going to kind of balance that out. The renewal is going to mirror the healthiness of that group and the performance of that group, whereas other carriers might blend them a little bit. But I appreciate everybody that was able to make today's meeting, or for those in the future that are watching this recorded, definitely reach out to the girls at URL should you have any more questions about this.
Yeah, thank you again. I hope everybody has a great rest of your day.